her skin is just absolutely, she's 1 month. You don't normally see this good quality skin at 1 month. Hi, I'm Dr. William. I'm here with this total maniac. So she's a recovery maniac. I just want you to take a look at her skin. She has a beautiful shape. She had a really good preoperative shape, and she had the winning combination. I don't know if you know that. Do you know that? You had the winning combination. Well, you can see it now. So she was a very good candidate. But what I'm really impressed with is her recovery. I mean, that's a huge focus because, you know, if I think about it, my operation is a pretty short period of time. And then recovery is all of this length of time. And it's so important that the patients are doing the correct thing to get the very best result. And she's not going to change her shape with doing things for recovery. That was done in the operating room, and that's her genes. So she doesn't have control over that. She can't compress her way to a better shape. But what she can do, and what she has done and continues to do, is to recover well to not get fibrosis. And when I was talking to her earlier, she's like, I don't want fibrosis. I'm like, well, you're not going to get it because you're doing all the right things. And it's very simple. And I feel so passionate about this because I've seen it so many times where people follow the Ogee recovery protocol. You do the things that are required to get the best skin, you get really good skin. And that's the whole point of having this surgery, is we want you to get a beautiful shape, and we want you to get really good skin, and we don't want you to have fibrosis. Following the Ogee recovery protocol is the secret to not getting fibrosis. And she has done that, and she continues to do it. But I just want to show you, you know, her skin. And I'm sure people will be chirping about her belly button looking with a little sideways. We don't have control over the belly button. It's her belly button. She's had a piercing here before, which always tickles me because people are worried about scarring, and then I've never seen a belly button scar that really leaves a good scar. But her skin is just absolutely, she's 1 month. You don't normally see this good quality skin at 1 month, but it's with rolling, and it's with Fibroguard, and it's use of the boards and the foams for the appropriate amount of time. If she's wearing a board and compressing here, she's not going to get flatter. She doesn't have any internal fat, and I've removed her external fat. So now she's nice and slim and flat, and she actually has like a nice little scoop that's here, which will actually get better because, believe it or not, she's still swollen here. She's going to shrink probably another 5%, 7%, something like that. But what I'm so interested in is the skin, because you touch the skin and I don't feel any lumpiness in here at all. This is totally smooth. And so her back as well. I mean, she's like a recovery champion. This is just soft, and she's only 1 month, and this is just smooth. And obviously she has no fluid. Her scars, this is the worst time for scars. At this 3 to 4 week mark, you'll see the scars don't look very good, but with scar care, she can work on those. She's nice and soft. Everything is really, really soft. So she's just done a masterful job of looking after her skin, and that will give you the very best of both worlds, because you get a really pretty shape and you get really beautiful skin. And then you're going to the beach, she's wearing a bikini, and she's not walking around with telltale signs of liposuction. I mean, it really sucks if you have a good result from lipo, but then your skin doesn't look good. So here we've got beautiful skin, and I can tell you, you're not gonna get fibrosis, okay? Because you're rolling and doing all those things, and it's wonderful. I'm so happy.
Thank you, I'm happy too.
Thank you.